Thank you for joining Cancer Support Community Atlanta for the Tell Me More series. This program focuses on cancer and cognition and is led by Nicole with Northside Hospital Cancer Institute. For more information on other installments of the Tell Me More series, please visit Cancer Support Community Atlanta's website, cscatlanta.org.
Hi, my name is Nicole and I am the speech language therapist for Northside Outpatient Rehabilitation Services on the Atlanta campus. It is my pleasure to introduce to you how cancer may affect cognition during or after your treatments, whether it be at the very beginning of your cancer treatment journey or once you have done 1 to 2 years out from your journey. Your goal is to return to everyday life activities. However, sometimes you may notice that these things that you have been able to do once before may now possibly be challenging regarding cognitive changes. This goal of this Tell Me More presentation is to provide you general information to help you to get resources to take the steps to improve your cognition and to improve your overall quality of life. I hope my information that I provide for you guys today will give you the tools to succeed in your journey of cancer survivorship to live life fully once again. If you need any information, I provided my contact information. So I am located at the Medical Tower. We have an actual oncology rehab staff there with OT and PT. So if you have any questions, you are more than welcome to reach out to me, and please do not hesitate to reach out. So, have you ever felt the following changes or challenges during or after your cancer treatment regarding your cognition? Many of these typical characteristics will be where there's really no time frame as to when you may feel these characteristics. So sometimes, depending on the individual with your treatment and your health, will make a difference as to how severe you may feel these cognitive changes. But many people may feel things like having difficulty recalling information, concentrating on a task, word finding difficulty processing or remembering recent conversations, needing frequent reminders. That's something that a lot of people may have experience with. And also figuring out where you put things or recalling where you placed your items. And also too, feeling very fatigued. A lot of people experience this. And again, it just depends on how you feel and what treatments you have been through, and everybody's unique regarding how it affects them. So, but regardless of these changes that you may be experiencing, it can definitely affect your quality of life. So, how do we get these cognitive changes? But there's so many factors that will kind of intertwine with each other. So there's really no specific reason. Could be a multiple of reasons, as well as this could occur before, during, or even after your treatment. But on this slide, there are typically general ones that a lot of people will experience in combination. So a lot of the times the nature of the cancer itself will be a primary factor, especially if you have ones regarding your neurological status, like those with brain tumors. That is a definitely automatic cognitive change. But for others, such as the blood cancers, may not be where it affects the brain immediately. Chemotherapy treatments for sure can create that chemo brain or chemo fog. Sometimes in with conjunction with radiation treatment, that can also cause a factor. Other drug therapy treatments, that includes if you were to take gabapentin for your peripheral neuropathy, that can be a side effect with memory loss and word finding. Surgery, hormonal therapy, hormones, and your brain neurotransmitters work in hand together. So sometimes that may affect your cognition, but also too, the big ones: fatigue, stress, sleep deprivation, pain, depression, if you have infection causing that fatigue, not able to get your nutrition and being dehydrated, other medical conditions that are in conjunction with what you're going through can all play a factor in how we may be affected by cognitive changes during your chemo treatment or after. So the question is, what do you do if you feel like you have cognitive changes before, during, or even after your treatments? I think the number one thing you should do is definitely talk to your doctor or somebody from your medical team. So that way they will be able to send you to a speech therapist like me. So you would have to get a referral to receive cognitive therapy. And that's where we can come in, do an evaluation. We'll see where you're at your level of cognition, and then make a treatment plan with goals to get you where you want to be, depending on your life goals, whether it be returning to work, hanging out with the kids or grandkids, or traveling, whatever you want to do. That's where we can make goals and set them so that way your cognitive changes will not impact your quality of life. So other than speech therapists, sometimes we may need additional support services to help with your cognitive changes. So we do have a lot of people that will get the multidiscipline of not just speech therapy, but occupational therapy to help you with your everyday activities and your fine motor skills. Physical therapy, not just from a mental fatigue, but that physical fatigue. So they can help you with your walking, endurance, your stamina. Dietitians are a big part of the medical team if you have cognitive deficits, because you need to fuel your brain with good nutrition and hydration so they can guide you with that. Sometimes there is emotional changes. Those can be where behavioral health services, Northside has wonderful support for oncology survivors to receive the behavioral support from psychiatrists or psychologists. And also, too, working with neuropsychologists who can give you an in-depth analysis. They are wonderful because they do more of a in-depth cognitive evaluation that a speech therapist may not be able to have the instrument for. So we can work with them closely and help with the plan of care to add more or subtract things to it. So that's just a nice all-around overall team that can help you with your cognition. So in the end, when you think about it, it takes a village. So don't be afraid to reach out to additional support if you need to. So if you receive cognitive treatment, well, how do we treat it? So like I said earlier, it's going to depend on how your cognition affects you. It could be severe, it can be mild, it could only last for a couple months, it can last for a couple of years. So again, it's really going to depend on the individual. So the characteristics that we find and how it impacts your everyday life is how we set your goals and create activities to reach your goals. So, and a lot of the times we will try to do what we call restorative therapy. So restoring the skills that you once lost. Now, if there is more of a severe impact to where the restorative skills can only come back at so much of a level, then we use a lot of compensatory strategies. So in the next couple of slides, I will go over more of those compensatory strategies, but that's usually kind of how we do it. We do a combination of restorative and compensatory strategies. And sometimes the compensatory strategies will improve the restorative skills. So it's a really nice marriage that we like to use to approach to therapy. We do a lot of education because our brain is the most complex body part in our entire system. And so that is part of our job, is to tell you this is where you're having cognitive issues, why you're having cognitive issues, what is causing the cognitive issues, and what you need to do to implement skills or strategies or change of lifestyle to help improve the overall brain health. So sometimes it's a little bit like a health class, but it does help you understand why we do the things that we do. So that way you'll have a better understanding of why we implement strategies and activities. And also too, what's nice is that it's very individualized because we are all our individual beings. It's very much tailored to you. So that's what's really nice. So it's a very personal plane of care. And that's why treating cognition is a wonderful thing, because we get to know who you are and get to know your lifestyle and your family and your interests. And so we really take that in consideration when we try to implement goals and plan of care for you. All right, so for the time being, there are ways that you can implement cognitive strategies. So a lot of the times when you feel like, you're rushing through things, especially when treatment is, one thing after another, it feels like you're on this roller coaster ride. So one of the things I always tell everybody is to establish a routine or structure. So when you feel like life is out of hand and you just don't feel like you are in control, having some sort of established routine that is predictable will help. Plus, when you have an established routine, it helps fill in the gaps of when you may have difficulty with remembering things throughout the day. That way, oh, I remember at 10 o'clock, I was doing XYZ activity. So between 10 o'clock and 12, I was trying to remember what I was doing. So that gives you that pinpoint of where to seek out any recalling of a certain memory that you're trying to implement. So establishing routines is always nice. And that phrase, a place for everything and everything in its place. I think we all have that, where we put our keys here, we put our cell phone there. So I usually tell folks, since we lose our cell phone, always pick a few places in your most common rooms for that phone to be right there. So if you're trying to backtrack on where your phone is, you'll know where to go to those places first, because you've already established that routine of putting that phone right in that place. Taking mental breaks, because you are going a mile a minute and because of all the factors that are putting stress on your brain may be like an iPhone battery, where you may have where the iPhone battery just keeps running and running and running, and you get overheated, and sometimes you need a mental break. So that's where it could be something where you can just meditate, close your eyes, take a cat nap, or just do something where it's not cognitively demanding. And I usually tell my patients to do the most basic stuff in the evening, but do more of your harder things in the morning or when you feel the most refreshed. That can really just take a huge weight off your shoulders, so that way you can coast for the rest of the day. Minimize distractions. Sometimes it's just really hard when you're concentrating on a task and you've got a lot of things in the background going. So putting on the headphones or doing, putting some white noise on, that tends to be really good to filter out those sound distractions. Turn off TVs, if you're visually, being distracted. It's maybe good to be in a quiet room when you need to concentrate on more important things, like getting your bills, or if you are studying something or listening to a podcast, you really want to focus on it, or reading. Like I said earlier, work at the best time of your day. A lot of people feel more refreshed in the morning. Toward the end of the day, they feel like they ran a full marathon because of the cognitive and physical endurance. So that's kind of where you want to go ahead and say, let me get all the big stuff done in the morning and then do the easy stuff, or just coast in the afternoon, evening time. Do one thing at a time. I think, with us saying like we multitask and we do so much, technically that's not really good for our attention. What we need to do is that we focus one thing at a time. That will help us reach our goal to finishing an activity. So if that means to take one step at a time or to subdivide the task, that way it feels like you're accomplishing something and you just go at a slower pace. There's nothing wrong with that. But if you do too many things at once where you're going back and forth, you're really not giving your attention the full attention to complete the task, and that's where mistakes can occur. So that's what you want to avoid. Double check your work. Like I said, don't rush, take your time. And I think too, I think this is a major one, is it's okay to say no. Sometimes we think, I have to do this, I got to do this, I got to do this. And I think we just live in a very busy society. We just realize that sometimes we have to stop and smell the roses. And, we have to coast. Sometimes there's going to be days where you're going to feel good, but then you may feel bad that you did too much. And then the next day you may feel exhausted. So that's kind of where you want to pace yourself. So if you can be where you can, just divide the task up to your support group, whether it be your family, friends, coworkers, just to help ease the load, it's okay to do that. And like I said, it's okay to ask for help. So those two go hand in hand. So don't be afraid to ask for help. And also to reward yourself. I think we tend to be too modest of ourselves to be like, yeah, I should have done better at doing this, or I really should have done this. But even if you just get one thing done that you hadn't done in so long, and you're like, you know what? Even though I just folded the laundry, that might be a huge accomplishment for you, that you may not have been able to fold the laundry, several weeks ago. So it's okay to give yourself a pat on the back. So it's okay, brag on yourself. You want to celebrate those small victories. They're just as important as the big ones. So other additional cognitive strategies that we usually tell people to apply. Daily planners. There's so many out there. You've got ones with monthly calendars. You have monthly calendars with a weekly section. There's one where there's one every day. There's goal planning. There's so many out there. Pick which one you like. I know there's no specific one. It's going to depend on what you like. Some of them might be too busy. Some of them might be too plain. Some may not have enough room to put what you want. Daily planners are great. And it's okay if it's either, digital on your phone or the old-fashioned paper and pencil. Some people like the tactile paper and pencil. Some people like the digital because they are on the go. So again, it's going to depend on what you like. Calendars, again, could be on an app or on a good old-fashioned piece of paper and pen. Alarms, I love these. These are great for when you're busy and you can use your phone for the alarms. So I usually will tell folks to go to your alarms section, pick out the time, for example, with medications, or say that you have to take out the trash on a Wednesday. Put the alarm on for that day. You can choose the day that you want the alarm to be set. Label the alarm, for example, take gabapen, or take out the trash on Wednesday, and then pick an alarm where it sounds like the activity. So that way you can pair up the alarm with the activity, so that gets your mind going like, oh, that's right. That alarm reminds me that it's time to take my gabapen or take out the trash on Wednesday. Post-it notes, can't go wrong with those. It's nice to have those around. Diaries, so just a good old-fashioned notebook with line paper, sometimes that's good. Again, using the watches and the phones, there's so much with technology that we can use for reminder apps, and again, using calendars. I love using the Notes app on my iPhone. It's so great to have. You can have Siri or Google or whatever iOS you have to say, hey, so-and-so, or, Alexa, remind me to put this on my grocery list. It's nice to have that as your own virtual digital assistant. Make to-do lists. So I usually tell people, just brain dump, just whatever is in your head, you want to take that and place it on a piece of paper. So just brain dump, just write what you need, and then prioritize it later. Using pill boxes, it's always nice to do that, so you know exactly what pills that you need to take on which day and which time. It's also good to write written plans. Sometimes people may need that visual aspect and that tactile aspect of remembering that they wrote these plans or these lists. Video recordings, those are always good. Again, reminder apps. Learning to pay attention a little bit more. Sometimes we just have to cognizantly think, okay, I know I'm struggling with paying attention, so I'm really going to be an active listener and really use my five senses of vision, my hearing, my sound, feeling, all of that. So that way our senses can absorb more information in our environment. It's always good to think about learning things in chunks. The reason why, for example, like your social security number or your phone number are in chunks in 3 or 4 or 2 numbers at a time is to help with remembering those numbers in smaller sets versus remembering all 10 digits at once. So if you're learning things, remember 2 to 3 things at a time. That will be a whole lot easier. Association, linking new information with previous experience. It could be general knowledge, it could be your personal experience, it could be emotions or events in your life. This can be such a huge asset to you because it is a personal thing that you can associate with. So if you're trying to remember something, but if some random information or linkage or event or experience is like, it's kind of weird that I'm linking this, but it helps me remember, just go with the flow. That always seems to be so much better than just trying to just remember it and then not connect it to something else. Again, visual pictures. We are 70% visual when it comes to absorbing information. So that's where the paying attention can help us. So really look in your environment, really look at the details. So look at the whole thing first, and then specifically look at the details. So you get the lay of the land first, and then you'll have an idea of what to expect and then go more individualized. Mind maps. These are where you can organize your information more into a certain shape, like bubbles, or looks like a spider web, or do like a Venn diagram when depending on what you are looking into, organizing your thoughts and ideas. And first letter cueing. That's when if you were to think of something and the first letter comes about. So a lot of the times names come about where you're like, yeah, my neighbor, I just met them, but their name starts with a letter E. Oh yeah, Emily. Yeah, that's right. So sometimes that first letter cueing can be such a huge help. So these are very common strategies that we use. And in therapy, we would teach you these strategies in your everyday life. So we can definitely tailor it to you. So a lot of people will ask, brain games, what is out there that would help? So brain games are good. They don't cure, but they're nice to kind of stimulate a lot of those activities. So if you're going through treatment and you have to isolate, or, if you're feeling very tired, but you want to just do something that's not so physically demanding, these are some general brain games that a lot of people will use, and I recommend. So luminosity, that's a very popular one. If you're an AARP member, it's free. It's called Stay Sharp. Other ones that others like, Brain HQ and Elevate. There are free trials, so if you want to go ahead and download them and see if you like them, then you're more than welcome to pay for subscription, and then they will go through levels of challenging, so they may be able to test you where you're at, and then as you continue to progress, then the challenges of the games get harder. But even so, if you're not into apps or your computer, then there's just some general ones that you can do, like watching old game shows. Those are always fun. Family Feud is great. $10,000 Pyramid. Those, Wheel of Fortune, even the game Pictionary. I know that's a game show now. So those are great to watch. If you have to lay low for the day, maybe watch the old Game Show Network. You might find some good challenging game shows to watch. Deductive reasoning puzzles are really good too, because you have to use your problem solving skills, which also include memory and attention, to be able to solve them. So a lot of times people like to do crossword puzzles or Sudoku. But if you're not into those, I like to do like murder theme or mystery theme activities where you are given the clues and you have to figure out what belongs to who. So it's almost like the game Clue, like what weapon, was used to use for, the actual murder, that kind of thing. So those are usually fun if you like more of a story, kind of just an interest of finding something other than just something plain. But also too, can't go wrong with good old fashioned game boards. Monopoly, Sorry, Battleship, Chinese checkers. My favorite is Sequence. So those are really good to where you're using all of your cognitive skills to challenge yourself and compete, and strategy. It just kind of helps that brain think using all of those skills that you wouldn't even think that you're doing. Plus, if you like board games, it's fun. Card games are great too. So if you are wanting to play solitaire or bridge, poker, those are always good too. So whatever seems to be fun for you, that's how I want you to approach these brain games. Okay. So like I said, it could be digital or the good old fashioned board games. Also too, it's important to improve your overall well-being. So seek out those positive, relaxing activities, like I had mentioned earlier. Stay physically active, be outside, even if you cannot walk a certain amount of time, just do a few laps around a nice small area, so that way you're just outside in nature. Or if you're inside, just get moving. That really helps with the brain because it flows the blood there, and it just gives the brain the nutrition that it needs. Speaking of nutrition, seek adequate nutrition, stay hydrated. If you feel stressed, mindfulness, meditation, that's always good to have. It's good to reflect on the day, or just think about positive activities, positive affirmations. Always get rest. Always, always, always get rest. Listen to your body. I think we tend to push ourselves too much. So when your body's like tired, listen to your body. Needs the rest. Seek out support, like I said. Don't do too much. If it is overwhelming, it's okay to delegate those activities. And always learn something new, even if it's just learning, if you always wanted to dance or learn a new language, or even if it's just simple as whatever you want. That's what I want you to seek out. So as long as it's positive, it will not feel like you're exercising your brain. That's the whole key. The brain loves to be happy, so find happy things. If you have any questions to where you want to seek out rehabilitation services, we have several locations across Atlanta in the Canton, Cherokee, and the Cumming Forsyth location. We also are in Alpharetta, and we are here in Atlanta, as well as Gwinnett in Lawrenceville and Duluth. So if you have any questions, you are more than welcome to come back to this slide to get the information and ask for a referral to be sent over to one of those sites near you. I hope this presentation has given you plenty of resources to help you on your cancer survivorship to feeling like yourself again. But like I said, do not hesitate to ask any questions and to reach out to me or any of the rehab services for more information. And thank you so much for letting me present this information. It has been my pleasure, and thank you very much.
Thank you for watching this installment of the Tell Me More series. We invite you to visit cscatlanta.org to learn more about the virtual and in-person oncology programs available through Cancer Support Community Atlanta.